So hey everyone, I am Himanshu Bijlani doing MBBS first year from Jawaharlal Nehru Medical College Ajmer. So today's is our first video on upper limb, and today we'll be discussing about the collarbone or the beauty bone, that is the clavicle bone. So let's start. So today we will discuss about the bone clavicle. The clavicle is a long bone. It supports the shoulder so that the arm can swing clearly away from the trunk. You can also do this by putting your left hand on your clavicle and moving your upper limb away from the trunk. The clavicle transmits the weight of the limb to the sternum. The bone has a curved part called the shaft and the two ends, lateral and the medial. See, this one is the lateral end, also known as the acromial end. This one is the medial end, also known as the sternal end. This one is the shaft. So now coming to the side determination, see, this one is very important for the viva. The lateral end is flat and the medial end is large and quadrilateral. The shaft is slightly curved so that it is convex forwards in its medial 2/3 and concave forwards in its lateral 1/3. The inferior surface is grooved longitudinally in its middle 1/3. See, this one is the lateral end, which is the flat. You can appreciate this by seeing this diagram. This one is the medial end, which is somewhat quadrilateral. The shaft, which is convex in the middle 2/3 and concave in the lateral 1/3. The inferior surface has a subclavian groove. Now coming to the peculiarities of the clavicle. It is a only long bone that lies horizontally. See, in the upper limb, the clavicle is the only bone that lies horizontally. Rest all the bones are vertical. It is subcutaneous throughout its process. So you can identify this by putting your left hand on your right clavicle. It is the first bone to start ossifying. It is the only long bone which ossifies in the membrane. See, this line means that it is also known as the membrane bone, a bone that ossifies directly in connective tissue without previous existence as cartilage. See, in the embryonic life, the bone first develops into cartilage, then it develops into bone. There is no medullary cavity. See, this means that every bone has a medullary cavity which holds the bone marrow. Without bone marrow, this bone cannot produce blood cells. It is occasionally pierced by the middle supraclavicular nerve. The middle supraclavicular nerve is the branch of cervical plexus of the root value C3 and C4. It receives weight of upper limb via the lateral 1/3 through the coracoclavicular ligament and transmits weight of upper limb to the axial skeleton via the medial 2/3 part. Now coming to the features, the shaft. The shaft is divisible into the lateral 1/3 and the medial 2/3. The lateral 1/3 of the shaft is flattened from above downwards. It has two borders, the anterior and the posterior. The anterior border is concave forwards. The posterior border is convex backwards. This part of the bone has two surfaces, the superior and the inferior. The superior surface is subcutaneous and the inferior surface presents an elevation called the conoid tubercle and a ridge called the trapezoid ridge. See, I am repeating again the last paragraph. The lateral 1/3 of the shaft is flattened. See, this one is the lateral 1/3 which is flattened from above downwards. It has two borders, the anterior border and the posterior border. The anterior border is concave forwards. This one is concave forwards. The posterior border is convex backwards. This one is convex backwards. This part of the bone has two surfaces. The superior surface, see this one is superior surface, and this one is the inferior surface. The superior surface is subcutaneous. So you can see this again by putting your left hand on your right clavicle. The inferior surface has an elevation known as conoid tubercle. Tubercle means a small rounded protuberance or a small rounded elevation. See, this one is a conoid tubercle. It has also a ridge known as trapezoid ridge. This one is a trapezoid ridge. Ridge means an linear elevation. Now coming to the medial two-third. The medial two-third of the shaft is rounded and is said to have four surfaces. The anterior surface is convex forwards. The posterior surface is smooth. The superior surface is rough in its medial part. The inferior surface has a rough oval impression at the medial end. The lateral half of this surface has a longitudinal subclavian groove. The nutrient foramen lies at the lateral end of the groove. See, I'm again repeating up the paragraph. The medial two-thirds of the shaft is rounded and it's said to have four surfaces. So you can differentiate in the lateral surface and the medial surface. The lateral one-third was the flattened while the medial two-thirds was rounded. The anterior surface is convex forwards. This one is the anterior surface which is convex forward. The posterior surface is smooth. The superior surface is rough in its medial part. The inferior surface has a rough oval impression at the medial end. See, this one is a rough impression, which is impression for the costoclavicular ligament. The lateral half of this surface has a longitudinal subclavian groove. See, this one is the subclavian groove. On the lateral side, on the medial lateral half of the medial one-third. The nutrient foramen lies at the lateral end of this groove. See, this one is a subclavian groove and this one is the lateral end of this groove where the nutrient foramen lies. So what is the significance of this nutrient foramen? The nutrient foramen passes the neutral arteries which supplies the bones. The next point of the features is the lateral and the medial ends. The lateral or the acromial end is flattened from the above downwards. It bears a facet that articulates with the acromion process of the scapula to form the acromioclavicular joint. See, this one is the acromial end of the clavicle, which bears a acromial facet, it bears a facet. See, this one is a facet which is present on the acromion process of the scapula, this one, which articulates with the clavicle to form the acromioclavicular joint. So what does this facet means? A facet is a smooth, flat or nearly flat anatomical surface which is present to basically to reduce the friction between the joint. Now coming to the medial end or the sternal end. The medial or the sternal end is quadrilateral and articulates with the clavicular notch of the medullum sterni, which means with the sternum, to form the sternoclavicular joint. The articular surface extends to the inferior aspect for the articulation with the first costal cartilage. So that's all for today. We will cover the attachments and the clinical anatomy in the next video. For today's task, you have to tell me that how many primary centers and the secondary centers are there in the clavicle, and what is the meaning of these centers. What are the primary centers and secondary centers? For today's homework, you have to go through this topic thoroughly and these points will be very important when you will study the attachments of this bone. So that's all. uh, Please subscribe this channel, please share to everyone, to your friends, and please click on the bell icon to get the latest update. Thank you.